Hi, I'm Rich Lucas with HFMA. Welcome to HFMA's annual conference here in Las Vegas. I have the honor today of speaking with Linda Perryclear, Senior Director of Product Management. Welcome, Linda.
Thanks for having me. It's great to be here.
Absolutely. So I think we're going to talk a little bit about AI today. So what role do you envision AI playing in streamlining administrative tasks within the healthcare revenue cycle?
Well, that's kind of a loaded question, isn't it? It's a lot. And as we've been at the conference this week, we're hearing a lot of people talk about AI, and it's something that at Availity we've been focused on as well, because the revenue cycle is prime for applying AI. It's built on transactions that have been around for a long time. So whenever we see that, and it's a large data set, and it's a lot of repetitive work that people do, we see it as a great opportunity to apply automation and give people more capacity to do more value-added work. So yeah, I think there's a lot of opportunity in the denial space that we see, where we've been doing work around predicting denials, being able to give people the opportunity to know that something bad, we call denials bad in revenue cycle, that something is not going to happen as you would expect it, that the claim is not going to get paid or adjudicate. So what we see is if we can tell people that in advance, it gives them an opportunity to fix it at a lower cost and doesn't require as much work.
Great. Are there specific areas you believe will benefit most with the AI integration?
I think that the post-service space is really where there is the biggest opportunity, because that transaction of claims, statusing, remits, those are so standard and we know those data sets really well. I think that is really the area where we see the most opportunity.
Great. So how do you balance the implementation of AI and revenue cycle process with the need for maintaining a human presence, right? A human touch? And what strategies do you propose to keep that balance in place?
Yeah, I mean, so, our goal is not to remove the human touch out of healthcare administrative task or healthcare, right? Our goal is to give people the time and capacity to do work that helps people the most. So, when we look at areas of automation, again, it's just about making jobs easier for people to do, but the people still have to do the work, and giving people the opportunity to use their minds to really work on those complex cases, or to have real conversations with patients who are having trouble understanding something. And I think we can all relate to when you're a patient trying to figure out that, what am I going to owe for this care? Not being stressed about that because I'm already under stress because I'm having a medical issue. So if we can give people the capacity to work with people by giving them automation in their tasks that they're doing that's repetitive, that's a great opportunity and a great win.
Better tools for the humans.
That's right. Yeah.
So shifting just a little bit, leveraging clinical data is another sought after opportunity to innovate in the revenue cycle. What have been the challenges of implementing claims in clinical data, or integrating claims in clinical data?
So that is, I think, the emerging space where we're starting to see clinical data tied to administrative transactions. And it is challenging because clinical data is not as structured as the claims data or claim status transactions that we've been working with for years and years. It's in all different kinds of formats, comes in all different kinds of ways. And so the opportunity here is to use technology to pull out structured data, know how to use that data, and then use it to augment these administrative transactions. So this is really the opportunity where we see the biggest space for AI and for technology to jump in and help, and that could be in a lot of different areas, whether it's getting the data structured, helping identify patterns more clearly for clinical use that can then eliminate that waste on the back end.
Sure.
So lots of good opportunities there.
That's fantastic. So how is Availity addressing those barriers?
I wish I could say, oh my gosh, it's just easy. We flipped a switch and now everything's perfect and it's just easy as pie, but it's not. And so what we're working on is building solutions that will help take that clinical data in, structuring that data in a way that can be used for administrative tasks. And that's really where we see Availity's place. Because we sit uniquely between payers and providers, being able to facilitate that communication in a structured way, that's really an opportunity for Availity.
Fantastic. Linda, I've enjoyed our chance to have a conversation here at the annual conference, and I really thank you for your time.
Yeah,
Thanks
thank
for coming.
you. Thank you.
Absolutely.